Thank you, Dr. Deepesh. So we are ready whenever you are.
Thank you so much. Good morning, all. Today we are going to discuss about avascular necrosis of the hip joint. It is related to all the conditions of sacroiliac joint or the pain which is coming from back to knee or the groin area pain. Eventually, the diagnosis is by radiological evidences only. So we will discuss about radiological diagnosis plus other type of diagnosis of hip joint AVN. For that, first we have to understand that what is exactly avascular necrosis of the hip joint and what does it cause, what type of pain is having in this condition. We all discuss about this. So first, the main thing which we have to understand is the condition in which avascular necrosis is happening is at the hip area. The hip area is the main area of the necrosis of that bone. You can see here the joint, the ball of the femur of the longest bone of our body is getting necrosed at the head. This condition is known as avascular necrosis. As we can see in the name, A means absence of vascularity, supply of the blood, and necrosis is sort of degeneration or poor supply. It could be on the both sides of the hip joint, it could be on the single side of the hip joint. It depends on the condition. There are so many factors which depends on the condition and the severity of the avascular necrosis. So we have to understand the cause and the moment limited condition of the avascular necrosis. There are so many causes, including inflammatory cause, including steroid injections, previous course of any steroid therapy. It could be complete steroid therapy, including all types of injection of cortisone injection and all types of steroid. So we have to understand what type of joint is this and what function it do. This is a hip joint. It is related to a SI joint and in our pelvic girdle. It lies in this cavity, and this cavity allows movement in forward, backward, and in sideways and in inward, which is known as flexion, extension, abduction, and adduction. You can see in a square box there is a necrosis which is showing it's related to the inflammatory disorder. It could be due to rheumatoid arthritis, could be due to any trauma, any sort of injury. And it can lead to necrosis or complete degeneration of the hip joint. The pain goes towards the groin area. This is the groin area. Towards the thigh area or front compartment of the thigh. Towards the back area or at the gluteal region. And towards the
can you make
inside.
your screen bigger? I can't see screen is so, you can make bigger screen so that I can see clearly. It's very small in the corner. Sorry about it.
Sorry, Kamlesh, Dr. Deepesh cannot do that. It is your device and your setting. You'll have to make those changes.
Oh, I'm trying. I couldn't do it, so I thought it's from your side.
No, I think
it's
because he's got the slide up, Dr. Deepesh comes as a little small square. So if the slide is down, we can see him on the full screen. That's what the issue is. Yeah.
Okay.
No, but that setting also, we can change it in our own device, that how much ratio you can see. That's again a matter on digital connect we could take up. But for now, if you know how to do that, please do on your own device setting. And let's continue, Dr. Deepesh. Thank you.
Yeah.
Okay, sorry about it.
No problem. There are mainly 4 types of pain which come across the hip joint front pain or the thigh pain, inside pain or the groin pain, backside pain or the gluteal pain, or sideways pain. Sideways pain is also associated with radiculopathy of the back or the pain which is coming through the disc area. So now we have to differentiate how can we judge that our hip joint is getting degenerated or we are having any type of hip joint pain. We can do with a simple movement in front ways, in back ways, in sideways, plus inside. If you feel any pain inside the hip joint or at the thigh area, it could be avascular necrosis of the hip joint. How can we assess the condition that we are having avascular necrosis is basically by radiological evidences. By radiological evidences, we see X-rays and MRIs in our daily practice. So up to grade 1 and grade 2, we can see by X-ray. But in grade 3 and in grade 4, we have to do MRI by which we can assess the complete hip joint over that area. So it is responsible for basic three things, which is known as a normal gait pattern. Normal gait pattern changes when the patient is having avascular necrosis of the hip joint. Second is SI joint, sacroiliac joint, and third is pelvic stability. As we have discussed, our pelvic girdle is dependent on these two major bones and the alignment of these two major bones. By this alignment, we will see the basic structure of anatomical structure of the pelvic getting placed at spinal level. With the spinal, it get placed at a single alignment. If there is a condition of hip joint pathology or the condition of hip joint necrosis, it get degenerated. That area get compressed and the pelvic get tilted. So if we see, if we do assessment of the patient, we do check to patient, we see the alignment of the pelvic joint from behind, it will like this. So patient in this condition, patient will walk like this. So this is the gait pattern of the avascular necrosis of the hip joint. There are so many conditions, there are so many treatment remedies, there are so many different strategies to treat the initial or the early stages of the hip joint avascular necrosis, including pulse electromagnetic fields, including laser therapy, shock wave therapy, or there are so many types of Ayurvedic treatment also for cure the early stages of the hip pain. If hip pain is associated with the disc pain or the hip pain is associated with the degeneration of the spine, then it could be treated with combination of the both things. So in combination with the both things, we have to take care about the back and its alignment, plus the condition which we see in the hip, the movement limitation of the hip joint. We have designed so many protocols of exercises. We have been involved in so many types of researches for curing of the early stages of the avascular necrosis. So we will understand the avascular necrosis stages. So that stages are very beneficial for the protocol of the exercise. You will see this by the slide. First, we will discuss about the causes. In short, it is blood supply affected due to any injury, fracture, or dislocation. Dislocation could be there, any injury, any fall history, or prolonged use of high dose of corticosteroids. Steroid uses can give poor supply to the hip joint. Excessive alcohol intake like sickle cell anemia and radiation therapy. Radiation therapy or cancer treatment can also cause the avascular necrosis. These are the basic causes which we can see here. Now we will see about the treatment. There are so many types of different treatment. There are so many controversies also of the management of the hip joint treatment, but there are early pain management with physical therapy and lifestyle changes. Lifestyle changes includes postural changes, uh, alcohol and smoking, plus the limit of the diet, the dietary changes, carbohydrate intake. These all are the basic factors which we can treat at a home. Medications are NSAIDs, biphosphonates for pain and slowing progression. Bisphosphonates is related to the slowing progression of the necrosis of the hip joint. Advanced stages, we can go core decompression, bone grafting, and joint replacement. In joint replacement, we can see the implant we put it in the joint to get supported and to get movement of the hip joint. Now we will discuss short duration about core decompression, that what is core decompression and bone grafting. In that core decompression, we will see about the stages. In stage 1 or stage 2, we can see here the hip joint is normal in stage 1, but we can see the normal degeneration or the erosion around the border of the hip joint, that is stage 1. In stage 2, we can see the erosion or the degeneration or poor blood supply at the top of the head. In stage 3, it's going down and the head surface, complete surface of the hip ball is getting eroded. And in stage 4, this hip joint plus the pelvic cavity both are getting eroded at same place. These are the stages. There are basically only 4 stages by which we can understand the hip joint avascular necrosis. It could be associated with SI joint or any discogenic issue, the pain which is coming from a disc. So we will see about core decompression. What is core decompression? This is the core decompression. Core decompression is the external application to increase the blood flow and to maintain the blood flow at the head of the femur, at the hip joint. This is useful in stage 2 and stage 3 plus patients, stage 3A, 3B patients, in which we see the implant which we put in the hip joint is increasing the blood flow and the blood is going thoroughly to the implant, to the hip joint head, and the patient get stabilized after the core decompression. This technique is very useful for the patients who are not indicated for complete replacement of the hip joint. If it is broken or if it is moved to stage 4 or an advanced stage, then this is not going to work. This is completely failure in that cases. Then patient need complete replacement of the hip joint. Now we will discuss about 2 or 3 patterns and to correct the patterns of the walking. Whatever the condition is, we don't know the condition and we don't know the avascular necrosis of the hip joint. We just have to address the normal walking pattern with the hip joint pain. We have set a protocol of 6 exercise. We will discuss about that later. First, we will move to the gait pattern of the avascular necrosis of the hip joint. Now, we will discuss about the gait pattern first. This is the gait pattern of the hip pain. The normal pattern is like this. patient is walking like this, and in hip joint pain, patient will walk like this. This is a limping gait with dropping of the pelvic. As you can see, the pelvic is dropping towards right side. The patient is having one side hip deformity, or the problem is having on that side only. So patient is moving like this. We have to address 2 or 3 things. That we have to stabilize the knee joint first. When we will stabilize the knee joint, when we will do complete rehab to the knee joint, then the support will automatically come to the hip joint. Patient is walking like this due to pain. So we have to give target on basically knee joint and the abductors of the hip joint. So first and very important thing for the stage 1 and stage 2 patient, that we have to do stabilizing exercises of the hip joint. In stabilizing exercise of the hip joint, we will do simple movement of the hip joint with or without support. If we can do without support, then it's fine. Otherwise, we can do with support also, like this. If you will take support of any wall or anything else like dining table or bed, after getting support, we will do abduction movement in sideways up to 10 to 15 degree. One thing we have to take care that we are not doing any type of stretches here. We are just stimulating, we are just getting with normal basic strength of the hip joint of the right side. So for that, we have to do sideways movement like this and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm telling about exercises of one side only. If patient is having both the sides problem, then they can do both the sides. Otherwise, one side is indicated. Second exercise is backward movement with the support. I will move my hip girdle towards back side like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For this, I have to bend little bit towards forward condition. I have to bend little bit towards the wall, and the movement is behind like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And for the front movement, I have to take support of the wall. After taking support of the wall, I will do movement like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have done 3 sides movement. Now we will do inside movement. Inside movement is very important. It is really important to understand that how to move a hip joint inside. It could be painful for some patients who are having any dislocation history of the hip joint. We will take support of the wall and we will lift our hip joint. We will lift leg like this and move inside. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's a cross exercise with 2 types of movement. We are doing 2 types of movement. First is this and second one is this. We have to see this movement. We have to do this movement very carefully. So these are the basic movement which we will do to correct our hip gait pattern. Now, as the patient was walking like this, the pattern was like this due to pain, we have to correct our pelvic area also. So in the correction of the pelvic area, we have to see all the alignment of the pelvic joint in front of mirror. In front of mirror, you will see our hip joint. If the hip joint is dropped towards this side, you have to check the both sides quadriceps muscles. So for that, we will add one more exercise for quadriceps muscle. We'll do this in sitting. After sitting, we will give a gentle stretch to the leg in front and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is for strengthening of the quadriceps muscles because we have to strengthen all the muscles together: hip joint muscle, knee joint muscle, muscles of the pelvic girdle, plus abdomen muscles, because it is a complete associated approach towards the cure of the early stage of the avascular necrosis hip joint. So what we have done is quadriceps stretch or quadriceps strengthening. As I explain you one more time, it should get in sitting. The sitting should be in a straight way with legs folded and the complete extension of the leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. First, the second, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very important thing that we have to do the quadriceps strengthening one by one. Because if you do complete movement like this, 1 and 2 and 3 and so on one leg, then another leg, then your muscles get fatigue early. So we have to maintain a fatigue mechanism. We have to control a fatigue mechanism for this in exercises. So what we have done, that we have done completely, as I said, this is not a avascular necrosis protocol completely. This can be used for hip pain or for SI joint pain also. But for that, we have to maintain a balance both the sides. Because both the side, if you maintain both the side balance, then your pelvic get automatically aligned. The alignment is very, very, very important. So as we have seen, the patient was walking like this with complete knee bending, or the knee is getting lurched over the one side. What we have done all types of movement on sideways, backways, front and inside, 4 side, each side 5 repetition with 10 seconds hold, plus static quadriceps exercise of the knee joint, plus knee joint sitting SLR at the stool or at any plinth level. Now, very important part of the hip joint, that the hip joint is having all the movements over here. Hip joint is having all the movements. It is outside, inside, in front, and in back side. So when we will do all the movement of the hip joint, then this area, back side area, back area or front area, they all will get pain. They all will get sore due to exercise, or it could be due to any pathology of the hip joint also. So we have to treat all the area completely, including our SI joints, including our lower spine, including our tailbone, including hip joint and front compartment of the thigh joint. So if we see the complete protocol of the hip joint pain or any type of hip joint pathology, we have to address mainly 4 things, which is spinal pain, second is SI joint pain, Third is exact pelvic pain, or we can say exact hip joint pain. And fourth is knee compartment or groin pain. So we have designed a basic uh, exercise protocol for the patients who are having hip joint problem. So we will understand the protocol of the exercise, which is indicated for all types of patients. There is no any contraindication. There is only one contraindication if someone is having any history of hip joint replacement, then these exercise protocol is completely contraindicated. Otherwise, these are indicated for all the patients. Now we will start our exercise protocol. We have designed it for 12 minutes, 12 minutes protocol for the exercise, including basic stretches of the hip joint. So I will do exercise one by one. You can see, you can do at your home. You can do at your own. It's a home regime by which we can target all the four areas of the hip joint pain, because we are not going to leave any type of pain here. So we have to do all these type of exercise in a sequence manner. So for that, first we will do first we will do basic back exercise, that is extension regime. I will explain contraindication one by one with these exercises. So we have to target, we have to see, we have to take care of the contraindication of that. Can you see here? Visible?
We've lost your picture.
Yes. Am I visible?
Yes, now you are visible.
Yes. Yeah. Perfect. So what we have designed is a basic protocol which is targeting our back, SI joint, pelvic, and the hip area, including groin and the knee area. The main four compartment we have to give target of that hip joint area. So in this, I will request all the participants to do these exercises in sequence, because sequence is very, very important. So first, what we have done in standing was for the correction of the gait, for correction of the walking pattern. Now we will see the exercise protocol, including back exercises, but it should get followed at least 2 to 3 times in a week in a perfect sequence. Sequence is very, very important. So we will discuss about all types of sequence one by one. And contraindication, I'll tell you during the exercises that what are the contraindication for this specific exercises. If you are having this condition, then these steps are contraindicated and these steps are indicated. So you can shuffle or you can edit your exercise protocol according to contraindications of your back and the pelvic condition. Basically, this is indicated for all types of patients, but there are some issues, there are some conditions, including surgeries, or incontinence problem, which are contraindicated. Otherwise, almost all things are indicated. Although osteopenic condition or the patients who are having reduced bone density can also do these types of exercises, but sequence is really very helpful and important for these exercises. So first we have to see the sequence and type of exercises, and the intensity of the exercise is very important. We don't need to do in a hyper extend mode, or we don't need to do in a hyper intensity mode. We have to do these exercises in a gentle way with a perfect sequence. Now we will start with the back exercise, the core exercise, abdominal exercise, pelvic stretches exercise plus knee exercise. This sequence is very important. So we will start with the back exercise. It is in the prone condition, lie on your stomach like this, and get up like this with our elbow extended and neck in front, and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. Again up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And down. That was the first movement, or we can say the extension movement of the back joint. Now we will see second exercise. It is in the supine line. First was on your stomach. Second is on your back. As we have lifted our back, that was our extension regime. Now we will lift our back in a supine line condition. In a supine line condition, we lift our back like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is second exercise. What we have to see that the area which we are lifting, the intensity or the length which we are lifting is on or around 12 to 18 inches. It's not like this or this. This is not indicated for hip joint rehab purpose. What we are doing is stabilizing of the knee joint and the hip joint plus 12 inches lift. That's it. We have to wait for few seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One very important thing in this, if you are having weak core or if you are having weak pelvic area, including your hip area, then your balance will get like this. The balance will get like this. It means you are having weakness at your core area. If you are trundling like this, if the pelvic area is shifting in this exercise, it means your core is weak. So we have to do core strengthening also. The second step was again lifting of the back joint. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the second step. Now, the third step is stretch of the hip joint as much as you can, because due to degeneration, we don't need to overstretch. Overstretch can harm your hip joint. So it's a normal stretch. And we do prefer that you hold your leg from thighs, not from lower leg. Because if you hold from your knee or from your lower leg, then you may get hurt or you may get overstretched over the hip joint. So it is completely feasible and easy to stretch your hip from here and stretch in a gentle manner. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is for right leg. Same with the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It was for other leg also. This is for back area plus hip area. Step 3. Now step 4, we will discuss about step 4. We will do normal pattern of the hip joint movement. In that normal pattern of the hip joint movement, we will see a normal L-shaped movement. We have to maintain a L, 90-degree movement, 90-degree angle, and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is step 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In this step, we have one more step which is more advanced like this, but it is not indicated for old age patients or not having stability in lower limbs or having coordinatory disorder or any neurological problem. So we'll do in a single leg pattern like this and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is approximate 90-degree angle. It is the 4th exercise of the hip joint. Now, 5th exercise of the core and the hip joint combinedly is rotation of the hip joint. This rotation is completely contraindicated for the patients who are having history of hip joint surgery or the patients who are having history of any spinal surgery plus slip disc disorder. If you are having slip disc disorder, then this exercise, step number 5, is completely contraindicated for you. So we will see the step number 5. We have to lift 30 degree and give a rotatory movement clockwise 3 times and anti-clockwise 3 times. 1, 2, 3. It's a circular movement 3 times clockwise and 3 times anti-clockwise. It is an advanced exercise. If someone is there to help you, then you may take assistant of that person. With that support, you can do 1, 2, 3, 1, 2, 3. The very important part is to maintain your hip joint at the level of 30 degree. 30 degree maintenance is very much important. Now we will do with the second leg. By folding first leg, then we will do with the second leg. We are not going to do in a straight leg like this. One leg is folded, a back is supported completely. If any exercise in which hip is getting raised, means you are doing it incorrectly. Hip and the back should get rested on the bed. 1, 2, 3. 1, 2, 3. Both the sides, clockwise and anti-clockwise. The important thing is we have to raise at least 30 degree. That was the step 5. Next is step 6. For step 6, we have to get in sideline. In sideline, we have to straighten our knees like this and raise our hip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Both the sides, each time 5 repetition. We have to do this on both the sides. These are the basic 6 steps which we will do in supine or on the bed. Next are 2 stretches. 6 plus 2 is sag. Next.
Doctor, your frame is frozen.
Next we'll do 2 stretches. Should get done in sitting position, in which we will stabilize our knee joint. We will stabilize our knee joint with our ankle joint. Ankle joint is stabilized like this. After stabilizing the ankle joint, we will stretch towards opposite side. This knee is going towards opposite shoulder. This knee is going towards opposite shoulder like this. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, the next leg. The other leg like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Both the sides, 5 repetition. The knee is going opposite to the shoulder on both the sides. Now, the last stretch which we have done, it was for quadriceps muscle, it was for knee. In sitting, we will do stretch like this and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. With the other leg, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was from the both side, right plus left. 6 exercises and 2 basic stretches was there. First stretch was to stabilize the ankle joint, the knee, and towards the shoulder joint. It was the first. And in the second, we have done with the other leg, stretch like this. It is going towards other shoulder. You have to understand the pattern of the exercise. And next is static stretch or a straight leg raise. And hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then with the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have to give movement to our knee joint. We have to give movement to our ankle joint. If there is any problem during the walk on the ankle, if the pain is radiating from your back, then these exercises are getting done immediately. These are really helpful exercises for all the patients who are having back pain also. So it is indicated for SI joint pain, for back pain, for pelvic problems, for hip joint pain, or the pain which is in the groin area, the groin pain, plus knee area pain. So we addressed mainly 5 or 6 things in a combination way, but the exercise pattern was exclusively designed for stage 1 and stage 2 avascular necrosis of the hip joint. Because in early stages, there is no treatment of decompression, there is no treatment of surgical intervention. So maintenance is very important with medication. If we take nemoslides or if we take NSAIDs or if we take any type of basic anti-inflammatory program, by medication, then these physical therapy may help you very much to get rid of pain, because by this pain you may get affected on your spine, on your SI joint, on your knee muscles. So you have to give target and proper concentration of your hip joint pain, by which you can do a normal gait pattern, you can prevent your knee injury, you can do all complete strengthening of the core muscles. So that was for the today. Now we will discuss about the question answer sessions. Question answers we can take from any type of back issues also, because back issues are also sometimes related to the hip joint avascular necrosis. So we cannot leave them alone. It's complete associated disorder. So we see this first.
Yes, okay. Okay, yeah. Thank you, doctor. That was very useful again. I wanted to ask you, if I've got osteoporosis of my left hip, would that eventually lead to this avascular necrosis? Yes?
No, it's not necessary that it eventually go to the avascular necrosis. It's an osteoporotic condition. It can get stabilized with the medication of the osteoporosis. It's not necessary. If someone is having rheumatoid arthritis plus osteoarthritis or complete degeneration of the hip joint, then it may get worse. Otherwise, normal osteoporosis of the hip joint is not going to get avascular necrosis. But you had to take care about that. You should follow this complete protocol, because these 6 exercise plus 2 basic stretches are really important and made up of exclusively for the hip joint patients. So you have to see all these things. You have to maintain complete mobility of the hip joint, although in osteoporotic condition.
All right, that's good to know. I can do those exercises. And what if you've got a sacral ilio joint problem, what is that? What condition is that? How would it affect you?
See, it's a joint between the iliac. As you can see, this is the iliac area, and this is the sacrum area of your spine. This joint is known as SI joint, sacroiliac joint. Any pathology, any problem, or any difficulty in the spine, or any pathology at the hip joint, or any postural deformity at the tailbone or at the lower spine can lead to sacroiliac joint problem. As we can see, we have 2 dimples at our lower back area. This area is known as, or the surrounding area is known as sacroiliac joint. So if someone is having, for example, someone is having severe osteoarthritis of the hip joint, then hip joint will get displaced normally, or hip joint will get pressurized by the SI joint, or it will get pressure to the SI joint. The SI joint will get inflamed or that area. On this area, the inflammation get complete covered by that hip joint area plus tailbone area. So we have to see the SI joint also. SI joint is very important.
So these exercises you showed, will it help this joint?
Yes, definitely this will help. What we have designed for our patients is to complete cure of SI joints, lower back, groin area, hip joint plus knee joint. We were targeting all the 4 joints in a safest way. Although there are some types of exercises which can give you some sort of pain or some sort of limping for a few days, but don't worry about that. It is completely safe protocol for all the exercises, for all the conditions which we have addressed.
Okay, and when your joints crack, I notice sometimes when I bend my elbows or legs, my knees crack, my elbows crack. What is that telling you?
It's a normal mechanism related to the air filled in the joint cavity, which air get trapped at the joint cavity or the point released area of the tendon. Sometimes our tendon get noised by the cracking sound. So it's really normal. So don't get bothered about that. You don't need to crack it yourself. If it is going in a normal way, then it's fine.
Oh,
There is
that's
no
okay.
any.
Okay, somebody said it's old age now. You have to expect this when you get old. Okay, the last question is, if you get time at the end, would you show us the ear exercise for the headaches? Because it got cut off from the last recording. So when you get time at the end, yeah?
Ear exercise.
Yes, for the headache, because
Okay.
the video is
Okay.
cut off.
Yes. For the headache. It was in the last session. Yes. What we have seen, we have to do a basic alignment on the both sides of the face with the both side of the skull. What we have done is the ear stretches. We can do ear stretch like this. In ear stretches, the grip is very important. Although we can do all types of grips of the ear, but this is the most comfortable step to grip your ear. If you will grip your ear, then you will feel the complete stretch behind and in front of the ear. You'll stretch your hip, your ear like this, and hold it for 10 seconds. 1, 2, 3, 4, 10. The grip is from your thumb area and from your finger area, like this, like this. It is really important for headache, or especially for the cervicogenic headache, spasm coming one side or one side is going behind the ear is addressed by this and is completely useful for the headache.
How many times do you do it? And how long do you
Three
hold
times
it?
for 10 seconds hold is enough.
So how many times? Can I do 4 or 5 times a day, or just when you have headache?
No, just when you have headache, it's not like that you have to do again and again. Because if you do again and again, this is cartilaginous. You will get pain over here. The headache will go and it will come at the ear. So it's a normal stretch like this, and 3 times only. Indications are 3 times.
Okay, thank you so much.
Most welcome.
Can I ask a question?
Lower
Yes,
for lower back pain.
Yes.
I've had a hip surgery done, total hip replacement.
Okay.
But now I've got a drop foot as we've talked about it. But now my hip has started hurting for past 2 weeks or so. I don't know why that is.
Yes, it could be due to walking pattern. If you have impaired gait walk or a walking pattern with the limping, then you should do knee strengthening with back exercises. Because you had done all types of hip exercises, your hip is replaced, so you should get this completely away from each other, and you should do basic hip exercise, knee exercise, and back exercise. This protocol is also indicated for you.
Okay, so it's got nothing to do with the joint. Or it has.
No, nothing to do.
Okay.
No.
Okay, I was got
We
worried.
can do icing or
Yeah.
No, don't worry about it.
I'm doing hot and cold.
Yes. Post-operatively, yes, hot and cold both are effective, both are indicated, but the cold is more indicated towards that particular site post-operatively.
Yeah, because mine is 3.5 years now, so it's not like straight after the surgery or something. Okay, thank you very much.
Yes.
Lovely information.
Yeah. Thank you so much.